this is another very important short note, or in the form of a long question. They can ask you about the pharmacology of the eicosanoids, and in the eicosanoids, that is particularly the prostaglandins. So today's video, I'll be mainly focusing on the prostaglandins and the prostaglandin analogs what are used as a drug. So beginning with prostaglandins. So these prostaglandins, these are certain substances, these are certain chemicals what are being produced by the long chain fatty acids, and they are present they are widely distributed in the human body. And when we look at these prostaglandins, these are the products of long chain fatty acids, and these long chain fatty acids, they are widely distributed in the human body. Now what do we find is that these prostaglandins, how they are synthesized and how these prostaglandins naturally their body is going to synthesize. So in this video we'll be looking at that how these prostaglandins are formed and what are the drug analogs what are used in different methodologies and different treatments, how these analogs of these drugs are being used. So starting with, just because this arachidonic acid is the precursor and of the synthesis of prostaglandins, so what happens is, in brief, in a brief nutshell, I'll be giving you a discussion as to how this arachidonic acid is how these prostaglandins is synthesized from the arachidonic acid. So what happens is, during any kind of an injury or a trauma, what happens is that the cell membrane, the phospholipid layer of the cell membrane, in the presence of an enzyme what is called as the phospholipase, this enzyme, the cell membrane phospholipids, is under the influence of the enzyme, that is the phospholipase, arachidonic acid is formed. And this arachidonic acid, in the presence of the cyclooxygenase enzyme, it is going to form different types of prostaglandins, that particularly the prostaglandin F2 alpha, the prostaglandin D2, the prostaglandin E2, and the prostaglandin I2. So another pathway of this arachidonic acid, if it is happening in the presence of the lipooxygenase enzyme, so it is going to give rise to the leukotrienes. So these leukotrienes are being formed. So the precursor of these prostaglandins, it is the unsaturated fatty acid, which is the arachidonic acid. And this arachidonic acid, under the influence of the cyclooxygenase enzyme, it is going to release these many types of the prostaglandins. If the enzyme is lipooxygenase, it is going to form the leukotrienes. So these prostaglandins, they are basically responsible for the inflammatory symptoms what are seen during any kind of an injury or trauma. Now, the main prostaglandins what the body is synthesizing, it is the prostaglandin E2, the prostaglandin F2 alpha, and the prostaglandin I2. So in this video, we'll be mainly discussing about the pharmacological actions and uses of the prostaglandin analogs in the treatment of various types of conditions. So students and viewers, starting with, the first is the gastrointestinal tract. So the prostaglandin E2 and prostaglandin I2, they decrease the acid secretion in the stomach and they increase the mucus production. So acid secretion is decreased, mucus production is increased. So thereby, in the gastrointestinal tract, in the stomach, what is going to happen is, it is going to exert a cytoprotective action, and this cytoprotective action is seen because of the particularly the prostaglandin E2 and the prostaglandin I2, and the drug of choice for such the prostaglandin analog what is used as a drug for the cytoprotection of the gastric mucosa, it is the misoprostol. So misoprostol, that is the it is a prostaglandin E2 analog, and it is useful in the prevention of the non-steroidal anti-inflammatory drug-induced ulcers. So whatever ulcers are formed due to the use of long-term usage of non-steroidal anti-inflammatory drugs, so this prostaglandin E2 analog, which is the misoprostol. So this is the drug, this is the drug analog for prostaglandin E2, that is the misoprostol. So this misoprostol is used for the prevention of the non-steroidal anti-inflammatory drug induced ulcers. So what ulcers are being formed, in order to prevent them, this misoprostol drug is being given. The next pharmacological action, it is the next on the central on the, that is the cardiovascular system and on the blood vessels. So on the cardiovascular system and the blood vessels, particularly the main prostaglandin involved, it is the PGE1. So the PGE1, it is the prostaglandin, and the prostaglandin analog which is used as a drug, it is the alprostadil. So this alprostadil is used to maintain the patency of ductus arteriosus before surgery. So the prostaglandin analog of PGE1, that is the alprostadil, it is used to maintain the patency of the ductus arteriosus before surgery. Now moving on to the next important, that is the prostaglandin, that is the prostacyclin, which is also called as the PGI2. It decreases the peripheral resistance, decreases the pulmonary resistance, and therefore it is used in the treatment of pulmonary hypertension. Now moving on to the next important prostaglandin, that is the PGI2. It inhibits the platelet aggregation and it is used in the hemodialysis. So when the patient is on dialysis, in patients of hemodialysis, this drug, this prostaglandin analog, that is the PGI2, is used in hemodialysis to prevent platelet aggregation. So it prevents platelet aggregation. Now when we look at the eye, so these prostaglandin analogs, they are used widely in the treatment of so many medical conditions. So it is used in the gastrointestinal tract to prevent the non-steroidal anti-inflammatory drug-induced ulcers. It is used in the cardiovascular system and in the blood vessels. Next, where usage is found, it is in the treatment of eye conditions. So in the conditions of eye, particularly the prostaglandin, that is the PGF2 alpha, it decreases the intraocular pressure, that is the intraocular tension, it decreases, and the analog, what is the analog drug, what is used is, it is the latanoprost. So the latanoprost is the drug of choice in the treatment of glaucoma. So where the intraocular pressure has exceeded too much, in order to lesser down the intraocular pressure, intraocular tension, the prostaglandin analog of PGF2 alpha, that is the latanoprost, is used in the treatment of glaucoma. Now the another prostaglandin analog, that is which is used in the impotence, in the impotence, in the conditions of male impotence, it is the PGE1, and the drug of choice, the prostaglandin analog, that is of PGE1, it is the alprostadil. Alprostadil, it is the drug of choice which is used in the treatment of impotence in the conditions of erectile dysfunction. So this erectile dysfunction, what is seen in men, this prostaglandin analog is being used. Now when we look at the uterus, so in the pregnant uterus, the prostaglandin F2 alpha and the low concentrations of prostaglandin E2 is going to contract the pregnant uterus. So therefore these prostaglandin analogs, the drugs, particularly these prostaglandins, are mainly used in the conditions of midterm abortions, in condition of missed abortion, and in conditions of molar pregnancy as well. Now, last but not the least, in the uterus, when we look at the induction of labor, so when the childbirth has to take place, in the condition of induction of labor, the prostaglandin E2 and the prostaglandin F2 alpha can induce labor at term. So once the term of the pregnancy is completed and the childbirth has to take place, these prostaglandin analogs are being used to induce the labor pains in a pregnant woman. So the prostaglandins what are used is the PGE2 and the PGF2 alpha can induce labor at term. Now when we look at the adverse effects, so the adverse effects of prostaglandins can be seen in the form of nausea, vomiting, diarrhea, fever, Backache. So if backache is there, if prostaglandin analogs are given for uterine contractions, so the side effects can be seen in the form of a backache due to uterine contractions. And the next side effect, what can be seen, it is the injections are painful due to the sensitizations of the nerve endings. So students and viewers, this was a very short discussion where I've tried my level best to give you in simple terms the pharmacological actions and uses of prostaglandins and in what all medical conditions they are used. So the pharmacological actions of the prostaglandins can be seen on the gastrointestinal tract, in the cardiovascular system and the blood vessels, in the eye, in the conditions of eye, in conditions of impotence, in the conditions of erectile dysfunction, and in the condition on the uterus for and in the induction of labor. So students and viewers, this was a very short discussion. If you like this video, give this video a thumbs up. And students and viewers who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. If you like this video, give this video a thumbs up, and don't forget to share amongst your friends. Thank you for watching.